Hi, I'm Garvin. This telecast is on Fucithalmic eyedrops. So what are Fucithalmic eyedrops used for? Well, they're used for bacterial infections of the membrane that covers the whites of the eyes and lining of the eyelids, or bacterial conjunctivitis. So how does Fucithalmic work? Fucithalmic viscous eyedrops contain the active ingredient fusidic acid, which is a type of a medicine called an antibiotic. Fusidic acid works by preventing the bacteria from producing proteins that are essential to them. Without these proteins, the bacteria cannot grow, replicate, and increase in numbers. Fusidic acid doesn't directly kill the bacteria, but leaves them unable to increase their numbers. The remaining bacteria eventually die or are destroyed by our immune system. So this treats the infection. So how do you use Fucithalmic eyedrops? Fucithalmic eyedrops come in a tube rather than a bottle. So first of all, you wash your hands before using the eyedrops. To start, you place your finger on the lower eyelid and gently move your finger lower. So like this, you put your finger here and just move your finger lower. This exposes the area where the Fucithalmic is then inserted onto. Put one drop, which is equivalent to the length of your fingernail, onto the lower eyelid. The tube contains a thick liquid that becomes more liquidy or watery once it is in your eye. One drop should be put into the affected eye or eyes twice a day, morning and evening. Treatment should be continued for as long as your doctor has prescribed. Don't stop treatment early if your eye feels or looks better. Treatment should not be stopped until 48 hours after your eye looks normal. When using these eye drops, you should take care to not touch the tip of the tube or any surface or to your eye in order to avoid contaminating the eye drops. After using the drops, you may see a white powder around the eye. This is normal and nothing to worry about. It can sometimes happen when the drops dry out. You can wipe the powder off with cotton wool. If you forget a dose of the drops, don't worry, just use them as soon as you remember and then continue with your next dose as usual. So what should you know before using Fucithalmic eye drops? You should not wear any type of contact lenses while you're having treatment with these drops. Make sure you complete the course prescribed by your doctor, again, even if it seems that the infection has cleared up. And stopping the course early increases the chance that the infection will come back and that the bacteria will grow resistant to the antibiotic. These eye drops are for use in the eyes only. Do not put them in your ears or nose or take them by mouth. Fucithalmic eye drops are sterile until opened. The tube contains a preservative that helps keep the eye drops sterile once they are in use. However, any medicine remaining in the tube after it has been opened for more than 4 weeks is likely to be contaminated with germs and should no longer be used. So who should not use Fucithalmic eye drops? People with known sensitivity or allergy to any of its ingredients. If you feel you've experienced an allergic reaction, stop using this medicine and inform your doctor or pharmacist immediately. So can you use Fucithalmic eye drops while pregnant or breastfeeding? This medicine has not been specifically studied in women who are pregnant or breastfeeding. However, the amount of medicine that passes into the bloodstream after applying eye drops is negligible. The fusidic acid has been widely used by pregnant and breastfeeding women for many years with no apparent harmful effect. So for further information or advice, you should talk to your doctor or pharmacist. So what are the possible side effects of Fucithalmic eye drops? So temporary blurred vision after putting in the drops, burning or stinging sensation after putting in the drops, and discomfort, irritation, itching, soreness or dryness in the eye being treated, and itching or swelling around the eye. So can you use Fucithalmic eye drops with other medicines? This medicine is not known to affect other medicines. However, if you're using more than one type of eye drop, you should administer them at least 5 minutes apart to prevent the second drop washing away the first, and use eye gels or ointments last. So if you have any questions, you can contact me through the live pharmacist. You can email me or call into Lynch's pharmacy in Cork. Thank you for watching and have a nice day.